is the 3rd of June. It's 5 a.m. As you can see, it's dark outside. This light is from the building here, but if I show you the sky, it's dark. I'm setting out to perform 3 PRS procedures today. I'll be doing a single PRS or a left-sided PRS for a 53-year-old lady. Following that, I'll be doing bilateral PRS procedures for a 76-year-old gentleman. I'll catch up with you later in the video. Bye. Today I'm going to do the PRS procedure for this gentleman in front of me, Mr. Manohar. He's 70 years old. He's suffering from osteoarthritis in both knees for the last several years. He has undergone many operations from 2000. The most significant one affecting his legs was a fracture to the left leg bone in 2000. He also had dislocation and in the hip and shoulder. They were all operated. He has undergone so far 4 operations to the left leg with fixation of bone by plates. Those plates have been removed, and recent X-ray has shown the presence of possible infection or osteomyelitis in the left bone. There is also in the left leg bone. There is also a screw, and in addition, he has undergone removal of the right kidney in 2018. He's suffering from hypertension and also accompanying heart problems. With all this, he's although he's 70 years old, he is a high risk candidate for total knee replacement, especially to the left knee, because if a total knee replacement is done, there is a chance of the infection in the leg bone flaring up, and even if a replacement is done on the other side, that is the right side, there is a chance of spread of infection from the left leg. Therefore, I have advised him a platelet-rich trauma procedure for both the knees, and he is willing to, he has accepted this. Have you accepted this, sir?
Yes, sir.
You have accepted this. So you understood the procedure?
Yes, sir.
Huh? That is, I will be injecting cells into both your knees to relieve pain. After this procedure, there will be a decrease in the pain of both knees, that is existing pain, for the better part of the day, and towards the evening you may have some slight mild increase of pain and discomfort, for which I will prescribe ice and some tablets. By tomorrow morning it should all be better. And now, having listened to what I have said, now you are willing to sign the consent form. So this is the consent, informed consent. Witness, please.
Mr. Ramamurthy.
Sign, please. Date 3/6. Time 5:45. Okay, now I am going to sign.
Dr. Mr. Venkatachala.
$555. Okay, inge Dr.A.K. Venkatachala. Nature of my illness, OA both knees. Name of the procedure, PRS injections, both knees. Risk nil. Benefit, pain relief. Alternate therapy, TKR, which you don't want. Alternate therapy. Risk of undergoing therapy for my illness, hypertension, single kidney, left leg infection. Query. Proposed PRS injections both knees. Good. Briefed patient, expected hour. Okay. Thank you. I'm all set to go into the OR. This is SVF injected into the knee joint under ultrasound guidance.